So today we are going to talk about Ayurveda for chronic pain, and particularly the holistic mechanisms and the neurochemical modulation, how Ayurveda reduce the pain. And we will talk about the scientific basis, the neurobiology, neurochemistry, anatomical effects, and the system, how it works. So Ayurveda is, most of you might know, is a traditional system of medicine originating from India over 5,000 years ago. And that offers a comprehensive biopsychosocial approach to managing the chronic pain. It conceptualizes the pain through the lens of doshas, which is vata, kapha, and pitta. Vata is movement and nerve impulse. Pitta is metabolism and inflammation, and kapha is structure and lubrication. And these attribute the chronic pain primarily to vata vitiation and ama or toxins accumulation in the tissues or dhatus, and also in the channels or srutas. The Ayurvedic treatment of chronic pain focuses on restoring dosha's balance, enhancing digestive and metabolic function or Agni, and detoxifying the accumulated metabolic waste and revitalizing the nervous system. Ayurvedic herb and the neurochemical actions are explored. I have done a lot of research into the papers, and I can say that several Ayurvedic herbs pose analgesic, anti-inflammatory, neuroprotective, and adaptogenic properties that contribute to the chronic pain relief through the biochemical pathways. Let's talk of Ashwagandha or Vitania somnifera. This is an adaptogen which modulates the HPA axis or hypothalamic-pituitary axis, reduce cortisol, enhances GABA-ergic pathway tone, and protects neurons by promoting neurogenesis and inhibiting the oxidative stress. It has been shown to reduce the neuropathic pain and fibromyalgia-like symptoms, and this is such a powerful herb which is more natural and bring the relief equal or more to the typical pharmacological agents which have more side effect. The second herb we are going to talk about is turmeric or curcuma longa. Its active compound inside is curcumin, which inhibit the nuclear factor kappa beta or NF kappa beta. Also inhibit the COX-2 inhibitor or cyclooxygenase 2, and also inhibit the tumor necrosis factor TNF alpha. In addition, curcumin also inhibit interleukin 1 beta and interleukin 6, and therefore reducing the neuroinflammation and peripheral sensitization. The third herb I'm going to talk about is Shalaki or Boswellia serrata. This has the active compound boswellic acid, which suppresses the 5-lipoxygenase or 5-LOX and leukotriene production, leading to significant reduction in the inflammatory joint and back pain and the associated pathways. It also reduces reactive oxygen species or ROS and the matrix metalloproteinases or MMPs, and also protect the connective tissue from the inflammation associated with these. The fourth one we are going to talk about Guggulu or Commiphora mucul. It exhibits anti-inflammatory and cholesterol-lowering effects by modulating prostaglandin synthesis and scavenging the free radicals, which have effect on the inflammation and pain. The next one we are going to talk about Guduchi or Tinospora cordifolia. And this enhances the immune modulation and downregulates the inflammatory cytokines and the pain mediators, which are responsible for persisting chronic pain. These herbal compounds act synergistically to modulate the nociceptive transmission and enhance the endogenous analgesia and reduce the systemic and neuroinflammation. Now we're going to talk about very special thing which is typical and only available in Ayurveda called Panchakarma or Panchakarma detoxification. And this is also associated with the neuroendocrine reset. Panchakarma is a cornerstone of the Ayurvedic detoxification procedure and include therapies like Abhyanga, which is therapeutic oil massage, Svedana, which is herbal steam therapy, Basti, which is medicated enemas, and Nasya, which is nasal therapy. And in addition, also Virechana, which is not commonly used, but also is a therapeutic purgation. And these techniques all aim to eliminate ama or toxin and have pre-inflammatory metabolite also are removed, which accumulate to cause the connective tissue and joint inflammation and pain. Also, Panchakarma or detoxification improve the vagal tone and parasympathetic activity through the sensory stimulation and lymphatic drainage, which has positive effect on the pain, and also reset hypothalamic-pituitary axis functioning by stimulating marma points, and this improve the systematic circulation. Now, in addition, oil-based Basti therapy in particular have demonstrated effectiveness in treating sciatica, low back pain, and osteoarthritis by delivering lipid-soluble anti-inflammatory compounds directly to the colon, a site rich in enteric neurons and the immune cells. Next, we are going to talk about Ayurvedic diet and microbiome pain access. Ayurveda emphasizes personalized nutrition based on prakriti or constitution to improve Agni or digestive fire and reduce ama and restore ojas or vitality. The specific diet target anti-inflammatory foods such as ginger, garlic, turmeric, and fennel, which modulate the gut-brain axis. Also, it advocates avoidance of incompatible food combination or viruddha ahara, which may increase the gut permeability and systematic inflammation. Also, there is fermented and probiotic food like takra or spiced buttermilk to support the gut microbiota diversity and regulate serotonin and GABA synthesis via gut-brain axis. Emerging evidence support the role of microbiome in modulating the chronic pain through the immune, endocrine, and neurochemical pathways, aligning with Ayurveda dietary principles, giving the positive and beneficial effect. The next, we are going to talk about sattvic lifestyle and mind-body integration. Ayurveda strongly emphasizes the role of mind-body harmony in the pain relief. Chronic pain is often exacerbated by the emotional dysregulation, anxiety, insomnia, and trauma, all of which can activate nociceptive pathways. Ayurvedic strategies include dincharya or daily routine and ratricharya, the night routine, to stabilize the circadian rhythm and improve melatonin secretion, which modulate the pain threshold. Meditation and pranayama or breathing exercise, which are part of the Ayurveda system, improved pre-central cortex regulation and limbic system regulation of the other pathways that are able to activate the vagal pathways and that reduce the pain perception directly and indirectly. Sattvic living, which promote non-inflammatory mental states through purity of diet, thought, and social interaction, is how Ayurveda bring holistic improvement in the pain. In neurobiological terms, these practices reduce amygdala hyperactivity, downregulate the sympathetic nervous system, and enhance the serotonergic and dopaminergic balance in the mesolimbic reward circuits, which are often impaired in the chronic pain syndrome. We can therefore say that Ayurveda's system level effect on the chronic pain is fantastic. Ayurveda addresses chronic pain through multi-pronged approach targeting inflammation, neuroimmune crosstalk, central sensitization, hormonal imbalance, and psychological distress. Unlike isolated pharmacological agents, Ayurvedic protocols offer a systematic level therapeutic model involving herbal pharmacology, detoxification, microbiota regulation, and mind-body integration. These mechanisms are now being corroborated by the modern neuroscience and systems biology, warranting more integrative clinical trials and cross-disciplinary collaborations to improve the overall effect and control of the chronic pain rather than isolated pharmacological agents. Thank you.